Welcome to Neuroanatomy Basics. The session for today is Pons. This is part 2. So, welcome to Neuroanatomy Basics, the series that we have on Unacademy Future Doctors. And yesterday we had covered part 1 of Pons. Okay. And today we're going to do part 2. Okay. So today is part 2 of Pons that we're going to cover in today's session. You all ready? Okay, so let's begin. As you all know, it's a 30-day Superfast course, and I want to give you all the basics of neuroanatomy in these sessions. So we have started with spinal cord, we're doing brainstem, and today we will finish Pons. Tomorrow we will do midbrain, and hopefully after that, once we're done with midbrain, we're going to move ahead. Okay. So my name is Chetanya Mittal, currently pursuing my MBBS from AIMS Delhi, almost done with my second prof. And so you have two subscriptions here. I want to tell you very quickly about the Unacademy subscriptions. One is the Unacademy Plus subscription, where you get full access to Unacademy. And the other is the Iconic subscription, where you not only get Unacademy, but you also get Prep Ladder. So what are the benefits of joining? So Unacademy is like a regular online coaching where you have live batches and subject-wise courses taken by the top educators. You can access the live sessions and the recorded sessions along with the Q bank, along with the live tests and quizzes, right? The advantage of Prep Ladder is that you not only get everything that is there in the Unacademy subscription, but you also get recorded sessions of all the 19 subjects which cover only the most important topics. So it's very good for revision before the examination. I would personally recommend that. And you can also go for the Iconic subscription because you will get the printed notes of Prep Ladder delivered to your doorstep, right? Of all 19 subjects. So the advantage of that is whatever you are learning from Unacademy, whatever you are learning from Prep Ladder, you can add to that notes and you will not have to make your own notes. Okay, the basic stuff is already written there. So it helps you compile all your information in one place. Is it understood? Right. So these are some of the features of the special class on Unacademy, right? You have interactive live session, you have polls, right? You have raise a hand feature, and you will get the lecture notes. You will never miss a session and you can learn anytime, anywhere, right? So let's talk about the updated and highly effective Q bank that is there on Unacademy. There are 25,000 questions according to the latest pattern of the examination. These are some of our toppers from the previous examination, the result that was declared. And we have a new feature on Unacademy called as raise a hand. You can even test it in the special classes, right? You can directly interact with the educators and clear your doubts. That is why I say whenever I am conducting a special class, please do join me. Very soon I will be conducting some MCQ sessions of neuroanatomy, right? And we have started Unacademy medical PG tests from December, right? These are weekly tests. Some of these are free and some of these will be unlocked with a plus course, right? So I would recommend you go for the plus subscription so that you can attempt these mock tests. We have started new batches for FMGE and NEET PG. And tomorrow we have a NEET PG combat, that is 45 questions, 60 minutes, right? Starting at 5 p.m. tomorrow. And for that you will need my invite code. So you can use my invite code CHETANYA10 to participate, right? These are all the details. You can only attempt it on Android and web. So if you have iOS, please try to attempt it from your laptop. Okay, so you have Unacademy scholarships as prizes. Along with that, not only that, you will also get Amazon gift vouchers up to rupees 10,000 depending on your rank. These are some of the offers on our plus subscriptions. With a 2-year subscription, you get 4 months free of cost. With a 1-year subscription, you get 2 months free of cost. And with a 6-month subscription, you get 1 month free of cost, provided you are using an educator code. And my educator referral code is CHETANYA10. So please only use this code to take a subscription. Does not matter if you're taking a NEET PG subscription, NEET UG subscription, or someone in your family is taking another subscription. You can use this referral code for the best offers, right? So these are the various pricing plans of the NEET PG subscription for both Plus and Iconic. And I would recommend you go for the 1-year or 2-year plans depending on what suits you. And if you are currently in your first or second year, even the longer plans are good for you. Okay? So all you have to do is go to the Unacademy Learner application, select your goal as NEET PG. Then you can select Plus or Iconic, select the duration of your plan, and then use my referral code Chetanya10 CHETANYA10, and this will give you a direct 10% off on your subscription. right? And you can also use no cost EMI. So let's begin with neuroanatomy basics. The topic for today is Pons. Okay, so remember in the first session we talked about the section at the lower part of the pons. So let me just go through everything once again. So these were the sections of the medulla that we have discussed. So this was the section at the level of medullary decussation. This was the section at the level of sensory decussation, right? And then after that you have a section at the level of the olive, right? At the level of the inferior olivary complex. Now these were the various cranial nerve nuclei. So remember here I told you that at the level of pons you will be taking two sections. One that passes through the lower part of the pons, right? That is going to pass from here. And one will be taken at the level of the trigeminal nucleus. So this is called as the section at the level of the facial colliculus. This is the section at the level of facial colliculus, right? Remember yesterday I taught you about the facial colliculus and neurobiotaxis. And the section at the upper level of pons, it is called the section at the level of the trigeminal nerve. It is the section at the level of the trigeminal nerve, right? So these are the two sections that we are going to be taking. And I told you that you divide the pons into a ventral part called as the basilar part and a dorsal part called as tegmentum, which are separated by a structure called as the trapezoid body, right? Trapezoid body. After that, come to this understanding that the section at the upper level of pons and the lower level of pons, the ventral part is exactly the same. The ventral part, it is exactly the same. The only difference is in the tegmentum, in the upper and lower part, right? So I had drawn a section. So I had divided the drawing of pons into three sections. Okay, so we had done two sections yesterday. One was the section of the ventral part of pons, right? Whether it is the upper half or the lower half does not matter. It is the section of the ventral half of the lower part of pons as well as the upper part of the pons. It's going to be the same thing, right? So you can draw it very freely, does not matter. And then I told you what is the diagram of the tegmentum of the lower half, right? So this is also called at the level of the facial colliculus. Remember here we are drawing the facial colliculus. So it's also called the section at the level of facial colliculus, right? So it's the section at the level of the facial colliculus, right? You can write in that, you can write at the level of the abducens nuclei. Okay? So the next section that we will be drawing will be a similar section. The only difference is that this is now going to be a section at the level of the upper part of pons, also called the section at the level of trigeminal nerve nucleus, the main nucleus of the trigeminal nerve. Okay, so it is called the section at the level of trigeminal nerve nucleus. Any doubt to anyone? So please write at the level of trigeminal nerve. Okay, and we will only be drawing the tegmentum because I told you that the basilar part or the ventral part of the pons, it's exactly the same. Okay, so please don't forget to draw this in front. Okay, so I'm only drawing this region. This is going to be the same as it is, as I've taught you in part 1. So we are only drawing the tegmentum here. We are only drawing the tegmentum here. All right, this region, this shaded region. ठीक है, शुरू करें. So before I draw it again, I will show you a diagram. So section through the upper half of pons. So first let's understand what that section is, and then you will be able to. Then you should be able to replicate it in a drawing. Okay? So let's do it. So remember this section that we had drawn. This was the lower part of the pons. Now let's look at the section of the upper part of the pons. Okay? So this is the section that I'm talking about. Now just imagine here that this here is the dividing line between the tegmentum. So everything above this is called as the tegmentum, and below this is the ventral part or the basilar part of pons, right? And in the ventral or basilar part of the pons, if you remember, what all did we have? We had corticospinal and corticonuclear fibers, the pontine nuclei or the nuclei pontis, and this was the middle cerebellar peduncle, right? The fibers from the nuclei pontis, they were going to the opposite half of the cerebellum through these transverse fibers, right? So that is how this arrangement was there of the ventral half of the pons. That is all that is there in the ventral half of the pons, nothing else, right? So that is about the ventral half of the pons. Here you have the trapezoid body separating the ventral and the dorsal half. Okay. So we have to focus on this area. We have to focus on this area. So let me, sort of magnify it for you, right? So just have a look at it. This is the fourth ventricle behind, right? Now you can see that the fourth ventricle, it has been closed off by the roof of the fourth ventricle. Okay, not going into those details, but on the sides of the fourth ventricle, you can now appreciate the superior cerebellar peduncle. You can now appreciate the superior cerebellar peduncle, right? Here you were able to see the inferior cerebellar peduncle. This was the inferior cerebellar peduncle at the level of the lower half. At the level of the upper half, you can make out the superior cerebellar peduncle, right? And in the superior cerebellar peduncle, which tract is going to go? The ventral spinocerebellar tract, it enters the cerebellum through the superior cerebellar peduncle. So the ventral spinocerebellar tract, it is entering inside the superior cerebellar peduncle. What was the main feature here? The main feature was the nucleus of the trigeminal nerve. So you have a look here. The main sensory nucleus of the trigeminal nerve is present. The main sensory nucleus of the trigeminal nerve, and also the motor nucleus of trigeminal nerve, right? So if you remember, the trigeminal nerve, it was very special because the nuclei of the trigeminal nerve, if you recall, there is a main sensory nucleus, then there is a mesencephalic nucleus which goes into the midbrain, and there is a spinal nucleus and tract of trigeminal nerve that goes into the medulla, right? So this is the main sensory nucleus or the pontine nucleus. So main sensory nucleus of trigeminal, it is present in the pons. Along with that, you also have the motor nucleus, right? Remember, the trigeminal nerve, it has both sensory and motor component. So there will be a sensory nucleus and there is also a motor nucleus, right? So that is going to be drawn in this diagram. And if you recall, the central columns are motor columns. In the center of the brainstem, you have motor columns, motor nuclei, and towards the periphery, you have sensory nuclei due to folding of the spinal cord, right? So if you can make out here, this is the motor nucleus of trigeminal. And this is the sensory nucleus of trigeminal. So towards the midline, you will have the motor nucleus, and towards the periphery or towards the outer side, you will have the main sensory nucleus. So in green here, you have the sensory nucleus, which is on the outside, and in blue, you have the motor nucleus of trigeminal nerve, which is present towards the midline. Okay? Then there is a central tegmental tract that was already present in the lower part of pons also. Fourth ventricle we have discussed, right? And in the midline, if you remember these structures in this very order, medial longitudinal bundle, tectospinal tract, rubrospinal tract, and the lemnisci, right? So which all lemnisci you had? You had medial lemniscus, right? Main tere saath love, right? So medial lemniscus, trigeminal lemniscus, spinal lemniscus, lateral lemniscus. Okay? We had drawn it in this order only. Medial lemniscus, trigeminal, spinal, lateral lemniscus. Okay? Apart from that, related to the lateral lemniscus, you had the superior olivary nucleus, and you can see in this diagram the superior olivary nucleus, it is related to the lateral lemniscus. Okay? So we have covered all the labelings. So let's quickly draw the upper part of pons and bring a closure to the sections of the pons. Okay? So to draw the upper part of the pons, we are only drawing the tegmentum, right? Right. So to only draw the tegmentum, let's say this is the section that you have to draw. Okay? In this section itself, in the center, yourself only draw the fourth ventricle. This is the fourth ventricle, right? On the sides here, you have the superior cerebellar peduncle, also called as SCP, superior cerebellar peduncle. Okay? No doubt here, superior cerebellar peduncle, you will be able to see it. Okay? Superior cerebellar peduncle. Next thing that you have to draw in this diagram is the ventral spinocerebellar tract, which is going into the superior cerebellar peduncle. Remember, there is a ventral spinocerebellar tract. It goes into the superior cerebellar peduncle. The dorsal spinocerebellar tract, it goes into the inferior cerebellar peduncle, whereas the ventral spinocerebellar tract, SC tract लिख रहा हूं. It goes into the cerebellum through the superior cerebellar peduncle. It's something that I told you when I was teaching you tracts of the spinal cord. ठीक है? Fine. Next thing that you all have to draw, and you know, some people draw it slightly differently, and people have different ways of drawing it. Okay, so you can draw it just next to it. You can just draw the trigeminal nucleus, because this is the main feature. Don't forget to draw it. So you will draw two nuclei. I'm drawing it with the same sort of color, you know. The sensory nucleus is going to be larger, right? So this is the main or the chief sensory nucleus. It's called as the chief sensory nucleus of trigeminal, right? And this is the motor nucleus of trigeminal. This is the motor nucleus of trigeminal. So you have drawn the sensory nucleus, you've drawn the motor nucleus, and out of this emerging here, you will have the trigeminal nerve. The trigeminal nerve, it is going to emerge out of here. The trigeminal nerve, it is going to emerge out of here like this. Okay, trigeminal nerve is going to emerge. These two fibers are together, and this is the trigeminal nerve. Very important. Midline structures, remember we had drawn here also. Medial longitudinal fasciculus. Okay, let me shade it with some other color. Medial longitudinal fasciculus, tectospinal tract, rubrospinal tract, and medial lemniscus. So they are going to be present as it is. They are going to be present as it is in the midline. So in the midline, please don't forget to draw these structures. I'm again going to use the same pattern. Medial longitudinal fasciculus, tectospinal, rubrospinal. Then what happens here is these lemnisci, they will become together. They will come together. So this is the medial lemniscus. This is the medial lemniscus. Okay. So you can label it. This is the medial longitudinal fasciculus, tectospinal tract, rubrospinal tract. Okay. Now very important to show here are the lemnisci. So this is the medial lemnisci, right? Then in the same complex, you will have two other lemnisci. And please remember that you will first have the trigeminal lemnisci. Okay, so in blue I have drawn trigeminal lemnisci, and in this purple color I have drawn the spinal lemnisci, right? One more structure is the lateral lemnisci, and lateral lemnisci, it is related to hearing. Okay, so related to hearing, you have another nucleus called as the superior olivary nucleus. So this is the superior olivary or olivary nucleus, right? And one tract that we are forgetting to write in the center, one tract very important, is the central tegmental tract. It is called as the CTT. Very important. Okay, central, because it is in the center of the tegmentum, it is called as the central tegmental tract. So that is how you draw a diagram, guys. That is how you draw a diagram. And this diagram, okay, how to give better presentation in prof exam? Please tell, since you score 80% plus in first prof. Okay, how do you know my prof percentage, Suryansh? Okay, so I'll tell you. Just the way I'm doing it right now, that's the way to increase your percentage in the prof examination. First of all, I will always advise you to carry as many colors as you can, right? So you will always see that if you look here, I have multicolored pens always with me. I have multicolored pens, and you might feel ki yaar ye to ladkiyan leke jati hai or something like that. But in medicine, the better you can represent something, the better you can explain a concept, and the better you explain, the more marks you get. Okay, don't focus on being bookish. Don't focus on being bookish. Like this diagram that is there, I did not draw it out of the book. Okay, I drew it out of my own understanding of the various tracts and the various pathways. Okay, so if you draw this diagram, this looks genuine, this looks real. And if you separate everything with a separate color, like I've done in this particular diagram, just look at it. Okay, the fourth ventricle, it's blue. That helps me remember that there is CSF here. Blue hai pani, right? And in front of that, I have a sequential order in which I'm drawing the medial longitudinal fasciculus, tectospinal, rubrospinal, and the medial lemniscus. I am connecting them to the trigeminal, spinal, and lateral lemniscus. And everything I've done with a different color so as to, impress upon the fact that it's everything is so distinct. Okay? So everything is very clear in that way. And I can probably take a separate section on how to improve your presentation in the prof examinations. But I'll give you some general advice, and I will separate it for anatomy, physiology, and biochemistry, because your percentage will not only be decided by your marks in anatomy, you'll also have to think about physiology and biochemistry. So in anatomy, wherever you can find a space, always draw a diagram, and that diagram, try to make it anatomically correct. Because schematic diagrams in anatomy, they show you that you have more knowledge than anything, right? Okay, if you are asked to explain the upper part of the pons and you write a paragraph, okay, it does not convey anything. But if you draw this diagram, it tells you the entire structure of the upper part of the pons. So wherever possible, wherever required, okay, even if it is not mentioned in the question, draw a small diagram. Even if you have some very little space, just draw it on the side so that it shows that you have clarity of concept. Same goes for physiology. Try to draw a diagram wherever possible. But in physiology, I know that diagram is not always possible. But here you should always remember to draw a flow chart. Okay. In physiology, flow charts are always possible. Okay. Especially when you have homeostatic processes, the flow charts, they will actually make your marks. Biochemistry, it's a whole different ball game, right? So in biochemistry, if you're able to draw metabolic cycles, that's amazing. Okay. So you should be able to draw the metabolic cycles. So for example, if you get a question on the Krebs cycle, just draw the cycle, and wherever you know that there is some inhibitor or there is some clinical correlate, you can always mention that in the diagram. So try to draw the cycles, try to draw the flow charts in biochemistry. Okay. And always write your answer in points, especially in physiology and biochemistry. Do not write your answer in paragraphs. Okay. And one more thing, highlight the keywords. Always highlight the keywords. Okay. For example, if you are asked, okay, draw the section of the upper part of the pons. So you will always highlight the trigeminal nucleus. The reason is that it is the section at the level of the upper part of the pons, and you can identify it by the presence of the two nuclei of the trigeminal, the sensory and the motor. So that is going to give you more marks. So I'll probably take sometimes a separate section or session on how you can increase your marks in anatomy, physiology, and biochemistry. But this is the way to go about it as far as the 3 subjects are concerned. I hope I've made myself clear. No doubts? Okay. So hopefully, that should answer your queries. Right. So once you're done with the section at the lower part of the pons, I've explained more or less every upper part of the pons. I've explained more or less everything to you. Okay. And remember, from medial to lateral, you will have the medial lemniscus, the trigeminal lemniscus, and the spinal lemniscus. Okay. MTSL. Trigeminal lemniscus, it contains fibers from the spinal nucleus of the trigeminal nerve. It is going to the thalamus. Lateral lemniscus, it is part of the auditory pathway, right? Please remember, it is part of the auditory pathway, and it is very closely related to the trapezoid body and the superior olivary nucleus. Okay? And you all know about the medial longitudinal fasciculus. It connects the 3rd, 4th, and 6th cranial nerve nuclei, and it is responsible for coordination of the movements of the head and neck and also the movements of the eye. Right? Very important. Okay. So one thing I have not told you so far is about the central tegmental tract. What is the central tegmental tract? Okay. So central tegmental tract, it includes ascending and descending fibers. The ascending fibers, they are coming from the nucleus tractus solitarius, right? And it is going to the thalamus. Okay. For taste sensation. It carries the taste sensation upwards. And it also has descending fibers that are coming from the red nucleus, and they will go to the inferior olivary nucleus. Also, it carries the rubro-olivary tract. And it is going to connect the red nucleus to the cerebellum. Okay? So central tegmental tract, it is something I haven't told you so far. So it carries taste sensation upwards, and it brings down fibers from the rubro-olivary tract downwards. ठीक है, तो central tegmental tract, some of you, if you are confused, you can write separately. Central tegmental tract. ठीक है, so taste fibers as well as the rubro-olivary fibers. Central tegmental tract. ठीक है, so you should know what goes in the central tegmental tract, what goes in the medial longitudinal fasciculus, what goes in the medial spinal, trigeminal and lateral lemnisci. Very very important. ठीक है, and it's very confusing, so always your homework for today, go to your rooms or wherever you study and write down about these 5 things. Write down about these 5 things. What are the components and what are their functions? Okay, that will give you a lot of clarity. So it's time for the clinical correlates. Remember, we had done the medial medullary syndrome called as the Digerine syndrome and the lateral medullary syndrome called as the Wallenberg syndrome. Do you remember? Okay. So now it's time for clinical anatomy of the pons. Okay. So before the clinical anatomy, I would like to do one more topic. Blood supply of the pons, especially the arterial supply. Blood supply of the pons. So pons is supplied by pontine arteries. Okay, very simple. So if you remember that this was your vertebral arteries, this was your vertebral artery from the other side. They were joining and forming the artery called as the basilar artery. Why was it called as the basilar artery? Because it was running on the basilar surface of the pons, right? Just behind this here you had, okay, this was the pons. So you have arteries which are arising like this. So these are all called as pontine arteries and they are going to supply the pons. So the supply of pons, it comes from the pontine arteries that are coming off at right angles from the basilar artery and it supplies the pons. चले आगे. Clinical anatomy pe. Okay, so there are 2 or 3 things that we have to discuss in the clinical anatomy of the pons. Are you ready? Okay, so there are multiple syndromes here. I'll just write down what all we have to cover. So first point to cover is pontine hemorrhage. Okay. The second thing that we have to cover is Foville syndrome. Okay, that is related to the pons. Foville syndrome. Third thing to cover is the Raymond syndrome. Raymond syndrome. Okay. Fourth thing to cover is called as the Millard-Gubler syndrome. Millard-Gubler syndrome. Okay. Last thing to cover is the cerebello pontine, also called as CP angle tumors. These are the lesions that we have to discuss of the pons. 5 lesions. Okay. So first of all, let's talk about pontine hemorrhage. Pontine hemorrhage. Now, why does pontine hemorrhage occur? Okay, it could be due to hemorrhage of the basilar artery. It could be hemorrhage of the multiple pontine arteries that are coming from the basilar artery. But usually pontine hemorrhage, it will occur in the setting of a hemorrhage of the basilar artery, right? So have you heard anything about pontine hemorrhage? What do you know about pontine hemorrhage? It is mostly due to hypertension. It is mostly due to hypertension, and it's a very serious condition. It's a very serious condition, right? So I'll tell you why, what happens in pontine hemorrhage, and you guys can try to understand what are the various things that are going to be problematic in a pontine hemorrhage. Okay, so in pontine hemorrhage, the main problem is that you have the pons, the blood supply of the pons is completely gone. So anything that has to pass through the pons will get damaged. Anything that has to pass through the pons, it will get damaged, and that is very problematic because pons, it is in the center. ठीक है, pons के ऊपर मिड ब्रेन है, उसके नीचे मेडुला है. तो जो मेडुला से ऊपर जाना है सेरेब्रल कॉर्टेक्स तक, वो भी पॉन्स के थ्रू जाएगा, और जो नीचे आना है वो भी पॉन्स के थ्रू आएगा. ठीक है. सो फर्स्ट ऑफ ऑल, which nucleus is there in the pons? Facial nerve nucleus, right? Facial nerve nucleus is there. So all the fibers of the facial nerve, they are going to get damaged. Facial nerve is going to get damaged, and the pyramidal tracts, they are going through the ventral surface of the pons, right? In the form of, right? If you remember the ventral or the basilar surface of the pons, here you had, so many fibers going. These were all the corticospinal and corticonuclear fibers. They were going from here. So pontine hemorrhage is a bilateral paralysis of face and the limbs. Complete bilateral paralysis of the face and limbs. Okay. Why of the face? Because seventh nerve nucleus is present here. Seventh nerve nucleus is present here. Also, all the corticospinal tracts, they are passing. All the corticospinal and even all the corticonuclear tracts, they are passing. So they are all going to get damaged. Bilateral paralysis of the face and the limbs. Okay. Then, if you recall that in all of these sections, you have something called as the reticular formation. So in the pons also you have a pontine reticular formation that I have not drawn here. है ना, ऐसी एक reticular formation होती है, and you know that reticular formation, it is responsible for keeping the person awake. So person will go into a deep coma. ठीक है, there is a deep coma due to damage to the reticular formation, right? There's a deep coma. Person goes into a state of deep coma. All right, deep coma. Then the pupils are going to become pinpoint. You have pinpoint pupils. You have pinpoint pupils. What is the reason for that? All the sympathetic fibers that are coming from the T1 and they are going to the eye, the sympathetic fibers, they are damaged due to damage of the sympathetic fibers going from the spinal cord, right, from the sympathetic ganglion to the eye. They are damaged due to damage to sympathetic fibers. Okay, they are damaged, so sympathetic fibers are gone, so you cannot keep the pupils dilated, so you will have pinpoint pupils. And pinpoint pupils are only seen in two conditions. One is pontine hemorrhage, the other is in the second one you will read in second year when you come to read forensic medicine and pharmacology. Okay, so I will leave you here. It's your homework. Tell me what is the other condition in which you will have pinpoint pupils. Very important. Okay, pinpoint pupils. The word pinpoint pupils, please don't ever forget it. Okay, pinpoint pupils. Pontine hemorrhage, very important. Okay, then you will have hyperpyrexia, right? Because the fibers coming from the hypothalamus, they are damaged. So hyperpyrexia, and pontine hemorrhage is very serious. It's almost fatal. Okay. Next syndrome is the Foville syndrome. Next syndrome to be discussed is called as the Foville syndrome. Can I discuss Foville syndrome? So first look at the damage and then I will make you guess the symptoms. Okay. So which part here is the damaged part? Fowell syndrome. What is the damage? Okay. So it basically damages this region. This is the region that is damaged. This is the region that is damaged. Okay, so now you can make out that, okay, the facial nerve is involved. Facial nerve is involved, right? And because the facial nerve is involved of one side, okay, it's not a bilateral, it can be a bilateral thing, it can also be of one side. So whichever side it is, you know, you are going to get facial paralysis. So ipsilateral. Let's change the color of this clinical box to make it slightly lighter, you know. Okay, so there is ipsilateral facial paralysis, right? Because the nucleus of the facial nerve and the facial nerve is damaged. Okay. Abducens nucleus is also gone. Abducens nucleus is also gone. Okay. And there is also something called as the paramedian pontine reticular formation that is present here, which is responsible for conjugate gaze. So whenever your right eye has to look towards the right side, your right lateral rectus will go here and your left medial rectus will also look to the right side. Okay, so both have to be involved simultaneously. And in that you have the role of a pontine formation. Okay, so you have a lesion, sorry, ये गलत बन गया है, ये corticospinal tract था, ये site of lesion. ठीक है, ये side of lesion. So I was telling you that there was ipsilateral facial paralysis. There is ipsilateral facial paralysis, and you also have ipsilateral conjugate paralysis. Ipsilateral conjugate gaze paralysis. So I'll just explain what it means. Okay. For example, you have damage to the right side. I'll just take an example. For example, you have damage to the right side of the sixth nucleus, right? So sixth cranial nerve, it supplies the lateral rectus. Okay. So let's say this is the left eye, this is the right eye. Now, so to look to the right side, you will use the lateral rectus of the right side and the medial rectus of the left side. This is called as conjugate gaze. So because this is damaged, right? And I told you there is also damage to the pontine reticular formation, because of which you cannot coordinate the movement of both eyes. So even medial rectus won't be able to work. So your right side, that is the ipsilateral conjugate gaze, is damaged. Ipsilateral conjugate gaze is damaged. That is the meaning of ipsilateral conjugate gaze. You won't be able to look on that side. You won't be able to rotate your eyes towards that side. ठीक है, that is important. Fowell syndrome. ठीक है, इतनी सी बात है. Fowell syndrome, otherwise not very important. Otherwise it is not very important. ठीक है. ठीक है. Let's go ahead. So what happens in Raymond syndrome? What happens in Raymond syndrome? Anybody knows? So let's have a look at this section, lower part of Pons. Let me bring it here. So in Raynaud syndrome, what happens is, so you all know this is the abducens nerve coming out like this. Which cranial nerve is this? Sixth cranial nerve, right? So it is supposed to come out like this. So in this, there are damages to this area. The damage is to this area. Okay, the damage is to the ventral or the basilar part of the pons. The damage is to the ventral or the basilar part of the pons. The site of the lesion, it is the ventral pons. The ventral pons is the site of lesion. Okay, due to basilar artery. And because of that, what do you have? So it is due to basal pontine vascular lesion, right? Okay. And because of that, there are two things that are damaged. You can make out. You have damage to the corticospinal tract. You have damage to this corticospinal tract. So you have contralateral hemiplegia. Right? Because decussation has not taken place so far. है ना, decussation नहीं हुआ है, तो hemiplegia कैसा होगा? Contralateral होगा, है ना? Medullary decussation will occur at the medulla. So decussation has not happened. So there is contralateral hemiplegia, and abducent nerve is damaged. So if the right side is damaged, the lateral rectus of the right eye will be damaged. So there is ipsilateral lateral rectus palsy, right? Lateral rectus palsy. Raynaud syndrome. Done? Simple. Next is Maillard-Gubler syndrome. Maillard-Gubler syndrome. Same lesion. It's almost the same lesion. Almost the same lesion. The only difference I'll tell you. Okay. So in Maillard-Gubler syndrome, what happens is, so you can understand that this is the facial nerve coming out. Facial nerve. Right? So in Maillard-Gubler syndrome, what happens is, and remember this was the abducens nerve, right? Sixth cranial nerve. So in Maillard-Gubler syndrome, what happens is there is damage to the facial nerve and the corticospinal tract, just like this. Okay. So in Maillard-Gubler syndrome, okay, you can even have the involvement of the abducens nerve. So it's just an extended form of, let's say, the Raynaud syndrome. So if I just, same basal pontine vascular lesion, it's the same lesion, basal pontine vascular lesion. The only thing is it also involves now the facial nerve. Okay. So it is basically Raynaud syndrome plus facial nerve involvement, which leads to ipsilateral facial palsy. Facial nerve. So Raynaud syndrome is nothing but a simpler form of Maillard-Gubler. So Maillard-Gubler, you can say it is Raynaud syndrome plus ipsilateral facial paralysis due to damage of the facial nerve. All right. Last is the CP angle. So Maillard-Gubler syndrome is nothing extra. Very simple to remember. Raynaud and Maillard-Gubler. Very simple. Last is CP angle. So in CP angle syndrome, what happens is, at the cerebellopontine angle. Okay. So what's the cerebellopontine angle exactly? You remember there is a middle cerebellar peduncle. which connects the pons to the cerebellum, which connects the pons to the cerebellum. Do you remember or not? Cerebello-pontine angle. So let me show you this in radiology only because it's a very important thing. Or okay, let's understand. Okay, so basically this here, this is the pons, this is the cerebellum. So an angle is formed here between them that is called as the cerebello-pontine angle. This region is called as the CPA or the cerebello-pontine angle. So we can even take a anatomical image and understand what all happens at this cerebello-pontine angle. Okay, so at the cerebello-pontine angle, the important thing is that you have some important structures. You have some important structures at the cerebello-pontine angle, right? So you have the choroid plexus of the fourth ventricle, you have the flocculus of the cerebellum, and very important, you have the facial nerve and the vestibulocochlear nerve, right? So there is a tumor of the vestibular cochlear nerve called as acoustic schwannoma, right? There is a tumor called as acoustic schwannoma or an acoustic neuroma, and it is usually present in the cerebello-pontine angle. Because of that, you are going to have damage to few things, right? So I told you at this angle you have three very important structures. Okay, one is the seventh cranial nerve, it is coming out. The eighth cranial nerve, it is coming out. And the one more thing that I told you was the flocculus of the cerebellum, which is a part of the cerebellum, flocculus, right? It is present near the CP angle. So if you have compression here, you will have facial nerve problems that will lead to ipsilateral facial paralysis. Ipsilateral facial paralysis. Okay. Besides that, facial nerve, it also carries some other fibers. If you remember, facial nerve, it also carries taste sensation from the anterior two-third of the tongue. So there is loss of taste from the anterior two-third of the tongue, right? Apart from that, it also supplies the stapedius muscle. So there is going to be hyperacusis because there is damage to the stapedius muscle. Okay. Then because of damage to the eighth cranial nerve, you have, so eighth cranial nerve is vestibulocochlear. So you are going to have deafness. Person is going to become deaf due to damage to the cochlear component, and due to the vestibular component, you are going to have vertigo. Okay, you know vertigo, dizziness. The person is unable to balance themselves, right? And then there is ataxia. There is ataxia on the side that is involved due to involvement of the flocculus. Okay. These are the important things related to cerebello-pontine angle lesions. So this is called as CP angle lesions. Is that clear to all of you? All right. So that brings us to an end on this session of Pons. So we have covered comprehensively the Pons in this lecture series, and tomorrow we are going to start with the midbrain. Thank you so much all of you for joining me. If you guys liked the session, please remember to hit the like button and drop a comment once this stops streaming. Share it with all your friends. Ask them to study neuroanatomy from Unacademy Future Doctors. Subscribe to this channel, hit the bell icon, right? And we also have a Telegram channel, so you can join that and you can download the PDF from there, right? Thank you so much all for joining me. Thank you so much all. See you tomorrow at the same time around 6:15 p.m. for the topic midbrain. Any doubts? I'm here for another minute. I hope you understood everything, Pallavi. All right. Okay, great. I'm glad. So I hope through diagrams, we are trying to understand everything through diagrams. So whenever I teach neuroanatomy, I make it a point ki, through the images, you understand everything, because a lot of it is about drawing and understanding. So this diagram that we drew today, upper part of the half of the pons. So there are three diagrams mainly. First, you should know how to draw the ventral surface or the basilar part of the pons, right? That is this part. Then you should draw the upper tegmentum and the lower tegmentum. Practice these three diagrams and you will achieve perfection. So this is the ventral half of the pons. This is the upper half. This is the tegmentum of the lower half, and this is the tegmentum of the upper half, right? Thank you so much, guys. Take care. If anybody of you is also taking an Unacademy subscription, you can always use my referral code CHETANYA10. And please don't forget to take part in the combat tomorrow. You can enroll in it, and you can use my invite code to participate in the combat, right? Thank you so much.